Hello and welcome to the Fertility Rewire podcast, a place for information and discussion around topics relevant to fertility. I'm your host, Kat Stevens. I'm a fertility coach and founder of the Fertility Rewire program, and I'm passionate about people being given sufficient information to enhance their own fertility awareness. Hello and welcome to episode 37 of the Fertility Rewire podcast. Now, I haven't got a title in mind yet for this. You will have seen it on the cover because I'm just going to see where this takes me, actually. I've got quite a few exciting things happening just to keep you abreast of. I've been contacted by a fertility doctor in Los Angeles who has asked to come on the podcast. So I'm really excited about that, and we have arranged the interview, and it's going to be late at night for me, so we'll see how I go. I do like an early night, but we'll see how we go. So I'm really excited about that. Just to update you a little bit on, I mentioned a Facebook group specifically for fertility ages ago now, and it hasn't really, I ended up not opening the doors, and I apologise to anyone who requested. It's kind of a bit in your face, isn't it, to join a group that's specifically about fertility. So what I have done is I have opened a group called It's Not You, It's Your Hormones, and this group is for anybody who has aspects about hormonal health, periods, fertility, any specific conditions, perimenopause, menopause, sleep, anxiety, stress. So I've just started it. We've got over 130 members now. I opened it the day before I'm recording this. So that's a place where you can find information without being too confronting even, and just fertility. So bear that in mind, that it's not you, it's your hormones, and I'll put the link in the notes. So I'm planned that I am going to talk about unexplained fertility, and there were a few titles battling around my head, like unexplained fertility isn't actually a thing, unexplained infertility is not a diagnosis, why do we accept this unexplained aspect of anything? So I wanted to just dig into that a little bit. So if you have been trying to conceive and it's not happened, and you've been to your doctor and you've had the basic baseline tests, FSH, LH and so on, so you have a blood test early on in your cycle during your bleed, and then you have another one later, hopefully about 7 days after ovulation, and your partner will have a sperm test. You will have a pelvic ultrasound, and you will have your tubes tested. There is a much more technical name for it, but you know what I mean by that, where they're going to insert dye and check the patency of your tubes, your fallopian tubes. Now, when these all come back normal, and if you could see me, you would see that I'm doing inverted commas with my fingers, then your fertility issues are deemed unexplained. Now, why do we accept this? Why do we accept that it's unexplained? It's not unexplained. It's unexplained based on the tests we've done so far. It's not unexplained. It means you ovulate, that there are sufficient, again, I'm doing inverted commas, sperm, and enough of them that move. And if you refer back to my previous podcast episode where I chatted with Barbara Scott about male factors in fertility, you'll know that these parameters are not sufficient. So it means that there isn't any specific blockage or kinking in your fallopian tube that would cause concern, and on an ultrasound there doesn't seem to be anything structurally wrong in the pelvis that might affect fertility. It does not take into account the quality of your eggs, the quality of the sperm, whether there is any DNA fragmentation. And really, really importantly, and not an expensive addition to testing, it does not identify key nutritional deficiencies that might have a significant impact on your chances of conception. Now, one of the vitamins that I do I've talked about on a previous podcast, is vitamin D. Now, vitamin D, most of us in the UK are probably vitamin D deficient. You know, it's a really, really not tricky, I don't know why I said tricky, it's a funny one because we wear sunscreen, obviously that's really important. Margarine is not really a food of choice anymore for quite significant reasons, and margarine was always supplemented with vitamin D. So there is cause to supplement some foods with vitamin D, but then we get onto the aspect of how your body will take up a synthetic form of a vitamin, and I've talked about this before in previous episodes, that bioavailability of a supplement is really, really key. So vitamin D is huge. Folate is huge. You might not be able to convert synthetic folic acid into a folate that your body can take up. There is a genetic issue in some women that means that this can't happen, but folate should be taken rather than folic acid, and methylated folate should be taken. But we can test for folate. We can test for B vitamins. B vitamins are hugely important when it comes to all cell health and therefore fertility, because the egg and the sperm are cells. This came into really something that surprised me actually, not super recently, about a year ago. I was working with a couple, and they'd had tests and they had referred to a fertility clinic in Leeds. Now I mention the name because they blew me away with what they did. So they tested their vitamin D and they were both low, and the female was really, really low in vitamin D. And they went back they had a subsequent test later and they still hadn't come up sufficiently. And the clinic said to her, we're not going to start the IVF, because that's the route they were going down. We're not going to start the IVF until your vitamin D is within normal parameters, which I thought was fantastic. And this test is not expensive. I mean, you can get a home test for vitamin D for about, in the UK, about £40-50. And so this is, it's not an expensive test, and it could save an incredibly expensive and physically and emotionally fraught procedure. And equally, if you have very poor vitamin D and you go through to IVF, the success of IVF is not guaranteed. The success of IVF is not guaranteed, full stop. But looking for something so specific and small sounds like a no-brainer, doesn't it? So I really feel that if you are trying to conceive, then don't accept the unexplained. Question yourself. What else would you accept the unexplained for? What areas of your life, if somebody said, well, we don't know what's caused it, so we'll do this really, really big thing instead, where would you accept that? I'm not sure there are many places that you would. I think I get so passionate about it because of, I've talked about this before. When I was diagnosed with multiple sclerosis, I got no answers. No one knows what causes it and no one knows what you can do about it, and therefore you have to accept that. And I was actually told by a consultant many years previously when I queried whether I had it, because I'm digressing, but it is important. The symptom that I had, if you got that symptom these days and you Googled it, you would see that it could be one of the first symptoms of MS. When I had this symptom back in 1991, there was no internet. That's how old I am. So I couldn't Google it. I went to the medical library because I was a student nurse, and I looked into it and I asked my GP, and he said, well, yes, it can be a first symptom of MS. And when I asked the neurologist about it, when I said to the neurologist, have I got MS? He looked at me and he said, oh my dear, you haven't got MS yet. Who's to know whether you get MS or not in the future? But this is your cross to bear, my dear. He said my dear a lot. This is your cross to bear. Some people have cancer and that's their cross, and this is your cross, but don't worry about it. Now, I really looked into this from every which way and every angle, and it was overwhelming, but I did find a way through it, and that's what's really spurred me on in the work I do with fertility and hormonal health, because there is an explanation. We just have to know where to look, and it doesn't necessarily mean that you have to have a lot more tests. What it means is we look at what possible factors could be affecting your fertility and we take appropriate action. For example, DNA fragmentation in the sperm is a huge problem, but it's not tested. Now, you can have a test, but that's an expensive test. Well, it depends where you're coming from. It's a few £100. I believe that's expensive. If you had that test and it showed that there was DNA fragmentation, then there is something we can do about it. So why don't we do something about it now, just in case that is an issue? And that's how my program works when I work with couples. We look at factors that could be an issue based on questions, lifestyle and issues, and we address them. And in addressing them, we find great improvement in outcomes. So if you think about the physical and emotional factors related within fertility and how they play with each other. I've talked about tigers before, and I've talked about how when your body is sensing that it is in danger with the presence of adrenaline, the repeated consistent presence of adrenaline and cortisol, it will switch down or switch off fertility. Getting pregnant in the face of tigers is a foolish thing to do, you'd agree, yeah? It's not safe. The body can't differentiate between an actual real-life snarling dangerous tiger and the little micro stresses. That's something that Dr. Chatterjee talks about. If you've not listened to any of his podcasts or read his books, that's really good information. These micro stresses build and build and build. So don't accept the unexplained, but don't make it more of a stress that it's not explained. There is information available, but it is overwhelming, I understand. And if you want support and help through that overwhelm, drop me a line. I love to say drop me a line. It makes it sound like you're going to write me a letter. But get in touch. I'm on Instagram at Fertility Rewire. I'm on Facebook at Fertility Rewire as well. You can send me an email. I'm at fertilityrewire.com. It's so important that you look deeper. And also the other issue that I'm getting a bit ranty, aren't I? But the other issue I wanted to talk about is if you have been put in a box, so I've talked about this before, if you've been put in the PCOS box or you've been put in the endometriosis box, then kind of stop looking for anything else. But people with PCOS do get pregnant, people with endometriosis do get pregnant. It is possible. It is possible. It's not a box that you need to be in. And you could be working so hard on that one aspect of your health that there might be another reason that is impacting your fertility. And that other reason will bear its head during IVF. So it's so important to cast your vision wider, cast your net wider. I was coming up with an analogy there that failed, but we're going to look wider. We're going to look at all aspects that impact fertility and address them. And that doesn't mean huge overhauls of your life. of your diet. It doesn't mean that this is the single focus that becomes all consuming, because these areas affect your wider general health as well. And the biggest advice I have, particularly when you're looking at egg and sperm health and quality, is this is so much more than getting pregnant. This is actually about ensuring the health of your baby. And that is a vital reframe that can work really, really well. So my take-home message is, please let us not accept the unexplained. It's only unexplained because we've not cast our net further and looked wider. There is an explanation. We can address issues, and it's really, really important that you have the information so that you then can make an informed choice. If you want to ask me anything about this at all, do get in touch. As I said, you can find me on Instagram and Facebook at Fertility Rewire. You can get me through the website fertilityrewire.com. I'm excited about the interview with the doctor from Los Angeles, and that will be out hopefully soon. If you've got any ideas about things you would like me to look at in more detail, things you'd like me to talk about, case studies perhaps, different aspects of what I see in my work, or if you want to appear on the podcast, then also please do get in touch with the contact details I've given you. But you take care now. Bye. Thanks so much for listening to this episode, and I really hope that you enjoyed it. And perhaps even it provoked some thoughts. And what I really want to convey through these podcasts is that through information and exploration, we can achieve transformation. And perhaps it's time to tame your fertility tigers. As ever, if you want any further information or you'd like to get in touch or give your feedback, then please do get in touch. You can find me at fertilityrewire.com and also at Fertility Rewire on Instagram and Facebook. And then online resources are also available at fertilityrewire.com.